All right, let's talk more about the GOP, the Republicans' budget plan. So the last we touched on this, they had passed it in the House, meaning that it can now go to the Senate and negotiations and all that can begin there. It sounded like this is going to be a process that there's still a lot of details to hammer out. There is still a lot of negotiations that need to be done, and it could take weeks. And I think this was said by Speaker of the House, Mike Johnson himself. But in its current state and what they're asking in the bill in terms of cuts to Medicare and Medicaid, let's talk about just how the impacts in one state, just a single state, just one. This is from Axios. GOP budget plan could cut Medicaid from 630,000 Virginians. Can you believe that? 630,000. That is insane. That's just one state. Before we get into this, we are going to be talking about they're now talking about passing a continued resolution, basically just to extend the current budget as is until later in the year, to prevent a government shutdown, because I think that, like, all this that I just said, that it's still in a very early process, is going to take weeks. That needs to be done by March 14th. So that's less than 2 weeks from now. So they're talking about doing a continued resolution. We're going to talk about that in this video as well. So stick around towards the end for that. But let's stick with this one and how the Medicaid cuts could affect people in Virginia. So U.S. House Republicans passed a budget resolution last week calling for up to $2 trillion in spending cuts, a move nearly impossible to do without cutting Medicaid. So why it matters. Virginia is one of 9 states with a trigger law automatically ending expanded Medicaid coverage if federal funding drops below 90%. So if basically if the federal funding drops below 90%, if you live in Virginia and you're on Medicaid, or expanded Medicaid coverage, it ends it. That's crazy. If that were to happen, nearly 630,000 Virginians would lose coverage, according to the latest data from the Virginia Department for Medical Assistance Services, which oversees the state's Medicaid program. More than 85,000 live in the Richmond area. Nearly all are below the federal poverty level, which is about 25,000 for a family of 3. Threat level. Julian Walker, a spokesperson for the Virginia Hospital and Healthcare Association, told Axios any changes to Medicaid expansion funding would have a significant impact in Virginia on patients, on providers, on access to care, and on the economy. And hospitals, especially rural ones, would be unable to front additional costs. The federal budget resolution calls for $880 billion in cuts over 10 years for the committee that handles healthcare spending, including Medicaid. Reality check. The proposal still has a long way to go before it reaches the finish line, and there's a chance it could become law without major Medicaid cuts. President Trump, who's pushed the GOP budget plan, has said Medicaid won't be touched, but that we are going to look for fraud. And we've already seen how careless and what they interpret as fraud. So, and Mike Johnson kind of said the quiet part out loud. He said, like, if you're, what do you say, like 28 years old, 29 years old, and you're just sitting at the couch playing games, whatever, like, yeah, you're not going to get health care. So most people are going to look at that and be like, yeah, fuck that person. And I disagree with that completely, because I am of the principle that healthcare is a human right, and that every U.S. citizen, every single U.S. citizen in this country should have access to free healthcare. I don't care what you do, what you don't do. Healthcare is a human right. So what I'm trying to say is they're going to be tightening the requirements for Medicare. They've already talked about adding like work requirements and stuff like that, which this whole healthcare being tied to work is silly and just so dystopian. Like, let me be clear. We are the only developed country in the world that does not offer some form of universal healthcare system. Do the research on it. So that's my problem here. They're going to call it fraud, and sadly, a lot of people are just going to buy it. But what they mean by fraud is, yeah, these people who don't work or these people who don't do anything, they shouldn't get health care. I'm sorry, but that is against my principles. We should guarantee health care to all U.S. citizens. Anyways, let's see. So, facing backlash, many Republicans have expressed concerns about slashing the program too deeply. Without Medicaid, achieving those major spending cuts won't be easy. And the thing is, they're increasing the Pentagon budget, border security budget, by I think it's $100 billion in the bill that was actually passed, when the Pentagon has failed its last, what is it? Don't quote me on the numbers, but it is definitely in this range, like what, 14, 15 audits for like the last 15 years. They can't account for like 60% of their spending. You want to look at fraud, corruption, and waste there? I think we should be looking at the Pentagon, not giving more money to it, and then you don't have to cut Medicaid. But of course, they're not going to go after the Pentagon in any meaningful way. As we see, they want to give more money to the Pentagon. So from Reuters, we have Republican Johnson wants clean U.S. funding measure, wait on spending cuts. So now it's just kind of getting messy. I honestly don't know the state of what they're trying to do, but let's talk about it. U.S. House Speaker Mike Johnson said on Sunday that he wants to pass a clean stopgap funding measure to keep federal agencies operating at current spending levels through September and lead proposed cuts for legislation for the next fiscal year. So it sounds like he wants the continued resolution, and then it's probably going to be a debate over these actual cuts for the next months to come. So during a series of television appearances, Johnson dispelled the notion that cuts identified by billionaire Elon Musk's so-called Department of Government Efficiency, which Democrats vehemently oppose, could be included in a continuing resolution known as a CR, intended to avert a partial government shutdown when current funding expires on March 14th. We're looking to pass a clean CR to freeze funding at current levels to make sure that the government can stay open, Johnson told NBC's Meet the Press. We are working hard to do our responsibility to keep the government open. Democrats have to help negotiate this, he said. But the comments did not appear to move Congress closer to a deal on government funding, with both Democrats and Republicans pushing back. There has been zero outreach from the Trump administration, and House Republicans have walked away from the negotiating table, the House of Representatives Democratic leader Hakeem Jeffries said in a statement on Sunday. That dude needs to step down. Republicans need Democratic support in the Senate, where their 53 to 47 majority falls short of the 60-vote margin needed to pass most legislation. In the House, Republicans need only a simple majority to pass a stopgap measure and hold a 218 to 215 advantage over Democrats. It was not clear, however, if Republicans can muster the necessary support. I am a no on the CR. Congress needs to do its job and pass a conservative budget. CRs are code for continued rubber stamp of fraud, waste, and abuse, Republican Representative Tony Gonzalez wrote on X. Yeah, I don't know if this was one of the people who had oppositions the first time around, like when it was going through committee and all that, but he's gonna vote for it. Anything we read here that says a Republican is opposed to it, it's going to take one phone call from either Mike Johnson or Donald Trump, and they'll flip. That's what happened the first time, except for, who was it? Was it Massey? Don't quote me on that, who still voted no because it didn't cut enough. So, House Republican Don Bacon also voiced opposition, posting, a continued resolution is bad for your military and weakens our national security. A CR means new weapons programs cannot get started. A year-long CR means we are not serious about building a military that will deter China, Russia, and Iran. Imagine if like someone had this like same energy towards like healthcare or something like that. Like, a continued resolution is bad for our Medicaid because we need more funding for, actually, no, a continued resolution is great for Medicaid because they want to cut it. But you know what I mean. Like, you're throwing this fit because we can't do more military funding. Are you kidding me? And I have news for you, Don Bacon. If you're such a hardliner against China, Russia, and Iran, where have you been? Where have you been the past week where Trump has been praising Putin, using Putin's framing and calling Zelensky a dictator, publicly shaming him in the White House? Where have you been? I don't know if you know this, Don Bacon, but we don't care about deterring China or Russia anymore. Iran, that's a different story. We don't care about China or Russia anymore. We don't, especially Russia. Have you been looking at what your president has been doing? Have you been saying anything about it? Where's your support for Ukraine if you're so big on Russia? Anyways, on Friday, top Democratic appropriators in the Senate and House of Representatives said Republicans had raised the risk of a government shutdown by insisting on including cuts made by President Donald Trump's administration in legislation for fiscal year 2025, which ends on September 30th. But Johnson said those cuts would be reserved for legislation to fund the government in fiscal year 2026, which begins on October 1st. We will actually be able to change the way this is done and incorporate all the extraordinary savings that DOJ is uncovering through fraud, waste, and abuse. The other revenues that President Trump is bringing about because of his policies, Johnson told Fox News program Sunday Morning Futures. Jeffries took aim at Republican plans to cut spending for social programs such as Medicare to pay for Trump's border and tax cut agenda. Democrats unanimously opposed a budget blueprint for advancing the Trump agenda that House Republicans barely managed to pass on Tuesday. There will be no support for partisan legislation that fails to protect the quality of life of the American people, Jeffrey said. Wow. I don't like Hakeem Jeffries, man. Dude sucks. Worst opposition leader I've ever seen in my life. Anyways, that's not the point of this video. Point of this video is that House Republicans are trying to screw you. They are trying to take away programs that benefit you, to give a giant tax cut to the rich, and to fund more border security and defense spending when, as we said, the Pentagon has failed like the last 15 audits. Anyways, let me know what you think in the comment section down below, and I will see you in the next one. If you made it to this point in the video, I just want to give a special thank you. If you enjoyed it, please hit that like button down below, and if you really enjoyed it, maybe consider hitting that subscribe button while you're down there. I want to hear your thoughts in the comment section. I will try to reply to any and all comments that I can. Until next time, watch that video on screen.